Hello and welcome. This is a chat to the professional, the show that has been designed to x-ray the activities of professional individuals and corporate bodies. My name as always Martin Chukwu. Last week, you remember, we had we started a conversation with the Honorable Minister of Health, trying to x-ray the activities of the Health Ministry, especially given the much talked about investment in procurement of equipment. We are saying that, okay, if after all these years we've been able to acquire some equipment, installed a lot of them, how far have we gone? Why do Nigerians continue to travel abroad to seek medical attention? Why is it that for every kidney transplant, for every cancer, for every special or specialized case or a heart problem, we are talking India, we are talking Europe, we are talking America? Meanwhile, in all of these countries, we have a lot of Nigerian professionals practicing there, and we are asking, is it that we cannot afford the equipment to achieve what we have to achieve? Or is it that we are having problem with the environment vis-a-vis encouraging the health professionals to give their best? And that's what we started last week. We are hoping that in this concluding part of the interview with the Honorable Minister, we shall be getting more insight into some of these issues. But don't forget also, like I promised you last week, we are going to get a reaction of Nigerian public on how they perceive the health sector. But all these will come your way after this break. Please stay.
Professional handshake. Professional profile.
Nigeria is the most important country in sub-Saharan Africa.
In-depth analysis of professional issues.
Of education, the collapse of culture in Nigeria. Even with cheating, we can't pass.
Yeah.
With the enormity of the cheating.
We've not done enough. There's still more to be done.
Join Martin Chukwu every week on this channel as he chats with the professionals on the program. A chat with the professionals. A program designed to x-ray the activities of professional individuals and corporate bodies.
Hello viewers, and you're welcome.
Join us.
Alright viewers, like I told you in my opening, we are going to get the views of Nigerian public on how they perceive the health sector. So we are going to get some of those reactions, and then we will be back with the concluding part of the interview with the Honorable Minister. Please stay.
I think a lot of money are being talked into our health system, but I found out that things are not really being done. Those who are into it or managing it are not really doing what they are supposed to do.
In terms of the federal or state hospital, they are not giving the best of the services. Or the private hospitals are trying. You can't say for sure, because statistically I don't have the data here. But all that I can see is that most people are not patronizing the government hospital. Probably because of lack of facilities or equipment or technical know-how.
Yes.
The bills for private hospital is more higher than that of the government. But life is life. You don't risk your life because of money. You have to give your life the best. And I think that's why people are more patronizing the private hospital instead of the government hospital.
Point of view, and to say the thing I have witnessed and the thing I have saw, then the hospital in Nigeria is very good, very well adequate, and the people that is there, I mean the doctors and the nurses that are doing their regular service to ensure that all the patients there get normal treatment.
Well, the services in our hospitals in Nigeria, like I said, with the present situation and with the present government support, the services is okay. because from the little I know, I learned some hospitals, some health centers have been equipped by the government last year. So, and the ones around us, when we go there, we receive enough treatment, adequate treatment anyway. But the only side we are having problem is that at times when we go, because in Enugu State we were told that there will be free medical services for pregnant mothers and children under 5 years. But when we go there, at times they will tell us there's no drug. We don't know what is really the problem, whether it is from the government or from the workers. We don't know whether the drugs are not coming or the facilities are not being reimbursed with the money to purchase the drugs. So that is the only problem. But for the workers and that, I think they are serving us very well.
That's good.
Well, this hospital is very good for us. So I really appreciate it because they take good care of us, both our children and also the pregnant women.
So our hospitals and health services in Nigeria, there are a lot of challenges facing that particular organization. You understand? Because in some area, or in some cases rather, the government may have a very good plan in all those hospitals and health centers. But the main reason is that to implement those things, there are always, or at times, we have some kind of problems here and there. You see people, especially the management of the hospitals or health centers, looting some of those government provided like equipment and drugs in the hospital. So, but still, I still encourage that the hospital in Nigeria is gradually improving. The health sector is gradually improving, but government should at least put more efforts on it. See that the drugs they supply to those hospitals, like community health centers and all those things, see that those drugs are well, properly dispatched to the nurses, and nurses will, at the end of it, give the drugs to the patients and not to divert it to their own private hospitals. At the end of it, if you go to a government hospital, you will not see drugs. They will prescribe the drug for you and ask you to go and buy it another way. So at times that thing is giving us headache. And if you watch television here and there, you will see government telling you that most of those hospitals are free of charge. Most of those hospitals you pay 10% of your salary and so on. You understand? After you must have receive treatment from them. But it's not like that. You just go to those hospitals, you don't see nurses, you don't see doctors. Even if they come, they will come late, they will tell you one reason or the other, and at the end of it, they will prescribe drugs for you. You go outside and buy the drug, whereby governments have supplied the drug to them. So governments should put more efforts, or more task force rather, put task force on ground so that they will monitor those places that they will give drug to. You understand? So that they will make sure the drug gets to the patient. You understand? So governments are trying. All of us, it's a collective fight.
The services is good, as I'm seeing it, because women they carry pikin come here all the time, always, and the child succeed normal, go home with peacefully, no problem. So the nurses and the doctors, they working well.
Okay, that's good. Health service in Nigeria.
Yeah.
In fact, from my own personal observation, as regard to health service in Nigeria, I can tell you without any fear or favor that the health service in Nigeria is very poor. Almost in every aspect of it, both their services and ours not. It's almost at a 0 point or level. In fact, government, I don't know if government has started doing anything about health sector, but then we've not experienced it, more especially in this our local environment. So if If government can wake up and do something about health sector in Nigeria, it will be a very important issue that should have to consider the effect of the living standard of the poor among others.
Anyway, the hospital, they are trying, the workers in the hospital, they are trying so much because they take much attention to their patients, give them frequent drugs accordingly. They are really trying, especially our mom. We normally call her mommy because what she's doing here is wonderful.
Professional handshake. Professional profile.
Nigeria is the most important country in sub-Saharan Africa.
In-depth analysis of professional issues.
Of education, the collapse of culture in Nigeria. Even with cheating, we can't pass.
Yeah.
With the enormity of the cheating.
We've not done enough. There's still more to be done.
Join Martin Zobu every week on this channel as he chats with the professionals on the program. A Chat with the Professionals. A program designed to x-ray the activities of professional individuals and corporate bodies.
Hello viewers, and you're welcome.
Join us.
Okay, those were the views of Nigerians on how they perceive the Nigerian health sector and what they expect from the government of the day. We also got a lot of reactions. We had some emails, text messages from viewers in the last week when we commenced our interaction with the Honorable Minister. And of course, a lot of you must have received some feedback as to your questions. But we are saying that we need more of those comments. Keep sending them and we will react accordingly. Right now we are going to take on the concluding part of that interview with the Honorable Minister. Please stay.
When I came in newly as a minister, one of the things I was confronted was an albino. Now we wanted to begin to partner with the Albino Foundation because the albinos have peculiar health problems. Some of them cancers, for instance, squamous cell carcinoma is very common. Why? Because they are not, because they have a lack of the pigment, the melanin, that's what it's called, that protects us from actinic rays. So they lack it relatively. So what happens is that the sun, the actinic rays from the sun, often has a dangerous effect on their skin, and they develop all sorts of skin cancers, apart from visual problems and so on. But let's take skin cancers. So this boy, you know, who was brought to us, many people remember his name, Philip. So he was brought to us, and they said, Minister, can the ministry help to treat? Now, ordinarily, the Ministry of Health does not have the mandate, really, to handle social welfare. We have other MDAs that actually have the mandate. But we now looked at it and said, well, we can call it our own corporate social responsibility, that we saw this, which is a health problem, but in an individual, we can see whether we can sponsor it as a corporate social responsibility. And we did that. And how did we do it? We said, do you have any hospital you've been going to? So initially they say yes. We say, we are national hospital. We say, do you have an estimate? They say yes. Bring the estimate. We saw it was 1 point something or 2 million between that. And they did the due process that was to go. And we said, well, for transparency, since this came from National Hospital, we pay by electronic transfer to National Hospital account. And we did that. But later we found that people were not quite happy with that procedure. On one hand, they should thank us for that, but on the other hand, they were quarreling that they didn't know we were giving the money to the hospital. And then they started spreading the propaganda that they found that National Hospital could not do it, and that they need to go to India. So we need to recover that money so that they use it. So I said, no. How did you get this estimate? They said they were attending. So we confirmed actually that he had a file. We confirmed actually that the consultant was attending to him. So we asked once again, even though we knew the truth, that normally they couldn't handle it, they would have referred. Said no, they can handle it. That's why they gave an estimate. And so eventually we ensured that Philip had it. Philip is doing well. It was done in Nigeria. We didn't have to leave the country to do it. But if we had backed out, they were gone abroad. And people claim that that case couldn't be done in Nigeria hospital Abuja.
Yes.
So I'm just giving you an example. Now, what is the second reason why people go abroad? People are also going abroad because they think one's government can sponsor. So you find people like me, if I know, if we apply to Mr. President, say, the minister is ready to sponsor, then automatically, even if it's just a little lump that could be exercised by a junior doctor, I want to go abroad and do it because I'm not paying it from my pocket.
Yeah.
So we're looking into that seriously, and the government is saying, fine, a time will come very soon, probably this year, that we're going to say, okay, fine. If you are a public servant or even any Nigerian that the government wants to assist, the Minister of Health should be able to say in writing that this thing cannot be done in Nigeria.
Cannot be handled here. Good.
Either due to lack of facility or due to lack of expertise. It has to commit it in writing. Only on that kind of condition should we, if we have the money as government, then sponsor the treatment outside Nigeria. If the minister says no, we can do it here, then as an individual, basic human right, you are still entitled to say, okay, I have my own money. My doctor resides in some country outside Nigeria.
Yes.
You have that right to go. But then government will not spend the money that belongs to all of us to pay for it.
Abroad.
That is one. Then, what's the third reason why people go abroad? Unfortunately, that's to me maybe the hardest part of my job. We further now saw that there are some unscrupulous medical practitioners who are making money from this.
Wow.
They split fees with people outside this country. And so they don't give a damn. Reliable information at my disposal shows that they get between 10 to 15% of whatever that patient is going to be charged. So that's why we've seen that there's no good selection with patients. We have had instances where people on their way to some of these places died at transit airports. Or sometimes when they are coming back. Obviously, if someone has terminal cancer, why can't he stay in Nigeria? If there's any drug you want to procure, it's even cheaper to buy the drug rather than sending the person on some kind of fancy trip. So either the person doesn't make it to those countries or on their way they can't make it to Nigeria. Because nobody, we are practicing, medicine is the same, modern medicine is the same anywhere. So if something is terminal and for now, no human being can do much, nobody can do much. So what's the other reason that people go abroad? And that is the one that really concerns me. Where I'm doing a lot of work. The president is so much on it as part of his transformation agenda. He keeps telling me we must do that. That is where actually due to necessity, there are instances, there are cases like that, where due to necessity people go abroad. Either because the facility is not there to even make the diagnosis, or where the diagnosis has been made to offer proper treatment, or even for follow-up, or that yes, facilities are there, but there's no expertise. Those cases are the ones that certainly we can't allow any Nigerian to die. Where for now we've not developed either such expertise or we've not provided such facilities. There's no reason why we cannot allow them, and even where government can assist, there's no reason why we cannot do so for them to go abroad and get treatment. But that is where the president is working hard on his transformation agenda. That is where he's trying to tell us clearly, ministers, do something. And that is the area where we're actually doing something, upgrading our facilities and training and retraining people. We're even doing things on our curriculum to tell you we're serious. So those areas, I promise you, it's not that by this year, 2012, that will come. No, I'm not saying that, but we'll work hard, certainly within the life of this administration, that will come to pass.
You know, what you just said is critical, because I'm aware that, like I mentioned initially, some of these countries that our people go to for medical attention, we have Nigerians practicing there. And I've always known that it's a case of either we don't have the equipment, or perhaps the work environment is a bit of an issue. Because I tell you something, sometime in 1998, I had someone who came from my area. He was with the Air Force, and he had been asked to go home and prepare for his death. He had, I think, cancer of the liver. And then someone put a call across to him to say, come down to Enugu. And I remembered, I'm not going to mention...
I was about to tell you that they were doing it in Enugu.
Yes, and behold, the surgery was successfully done, and a part of the kidney, or liver, sorry, that had
to be resected,
Yes, and I couldn't believe
it. Okay, fine, you are right, because that's the other point I didn't make.
Yes.
Sometimes the referrals are due to ignorance. You are perfectly right. Just that I couldn't really remember all the things. So what are we doing about that? Right now, we're almost through with that. What we're trying to do is compile. We've done the skills, but we did them in 18 federal hospital. But why we are delayed is I want to also get information from the private sector. We have information from the private sector because they are a bit organized now in Abuja, but it's not for the rest of the country. Okay. So what are we compiling? A kind of directory that will tell Nigerians for so and so kind of specialized treatment is available in this place. It may be a private, it may be a state hospital, it may be a federal hospital. It doesn't matter what is present, it's available in Nigeria. So we want to compile that and disseminate as much as possible through internet, through people like you, the media, through other means. We want to do that. And when that happens, you find that it also reduced because actually sometimes some doctors are not aware
that some of these things
are available. They just think that because their immediate environment didn't have it, they couldn't imagine that. Let me give you insight. For instance, things like total joint replacements. There are many hospitals that are doing that. I, for one, as you know, I'm an orthopedist, so I was doing that. There are many people in Nigeria carrying my artificial hip and moving around. So we are doing it. Even in state hospitals, you won't believe it. They are doing it. Even in some private hospitals. But even in Abuja here, there are private hospitals that are doing it. So it's just for that information to be given out. Look at things like kidney stones. There are hospitals in Abuja here that have the very latest. They've gone from hydraulic to laser. Now, if you're living in Abuja, there's no reason why anybody needs to cut you to remove kidney stone. You don't need to be cut. Good. I've even sent relatives of members of staff here to that place, and they've done well. They just put you under, and this race will be used and broken, and the thing is flushed. No single knife will be on you. And that same day, you'll be discharged home. In Abuja here, it's available. So we need to have such a directory so Nigerians will know. Sometimes people don't know these things exist.
Well, Honorable Minister, I know that if I allow you, I'm sure by tomorrow we'll probably not end our discussion. And like I said, I'm not patronizing. I believe you are one of the very few ministers who talk. The problem of Nigerian government, I'm glad I'm speaking with you, is that they do not talk. And when they do, they talk to the wrong people. And when you talk to the wrong people, of course, that's when the issues of rejoinders, was that what I said, was that what I didn't say, and all that. But if we begin to talk like it's done in other developed countries, I believe that Nigerians will be better informed. I know that things are improving, but I will also plead with you to encourage your colleagues to do more of what you're doing so that Nigerians will be in the know of developments in the country. Well, I'm afraid that's the much we can take on the interview segment, but the Honorable Minister, we hope that, I know you have a very busy schedule, that we'll be able to find out time within the next 2-3 months to have a review of some of these things that you've mentioned. But as always, my pleasure having you.
Thank you very much.
Professional handshake. And those of you, the medical students who have been watching, yes, you sent in a lot of text messages, and I believe I sent you the response that came directly from the Honorable Minister of Health. If you still have any issue, please go ahead and send us a text message, do us an email. We are also streaming online, and I'm sure you'll be able to get a response to whatever question you probably might be asking. But that's all for the interview segment. I'll be back to wrap up this show. Please stay. Alright, viewers, I'm afraid that's the much we can take on the show HR to the Professional today. In the course of the interview, I'm sure you must have seen some of the centers where you can get help for those of you who have been diagnosed HIV positive. Well, what we are doing here is to ensure that you have the information at your disposal. This is by no means a way of encouraging you into doing those things that will make you contract HIV, as it were. What we are doing is that for those who have already been infected, there's still life. And that's what the Honorable Minister said. And that's why we are providing with this information. I also remember that the last time I had him, we had several calls and messages requesting for that information. And the ministry has been gracious enough to provide us with that. From time to time, we shall be flashing or scrolling some of these centers so that you are better informed. And like I did mention, hopefully in the next 2 or 3 months, we should be able to get back to the Honorable Minister of Health, because health is a very critical area, a very critical aspect of our socio-economic life, as well as education. And whether you like it or not, there's nothing you can do without life. But that's the much we can take on the show, like I said today. 2012 promises to be a very good one for us all. And we are hoping that, as usual, you'll be a part of our year. So till next time when I come your way, I remain Martin Sobu saying stay blessed, and I'll see you.